Welcome to the deep dive. Today, we're diving into AI in healthcare, but with a really specific focus. The vibrant and complex landscape of India. You hear so much about AI's potential, right? Diagnostics, finding new drugs, tailoring treatments. But for this deep dive, our mission is really to get practical, to look at a huge fundamental challenge, cost. How do we make this amazing tech actually affordable, actually accessible across India's massive healthcare system? It's thinking about AI less as just, sci-fi tech and more as a potential tool, a helping hand for the day-to-day realities of providing care. And that includes dealing with the constant pressure to keep costs down.
And that's spot on. It's the central tension that comes through in the sources we looked at. On one side, you've got this huge promise, AI, improving patient outcomes, maybe even reducing overall healthcare costs in India. It's seen as this way to boost access and quality, perhaps without needing giant investments in new buildings and things like that. But getting the AI itself up and running, that takes money, sometimes a lot of money. So affordability becomes absolutely critical if this is going to be widely adopted.
Yeah.
Especially when, providers are already stretched thin, trying to deliver good care economically. It's this interesting paradox, isn't it?
Yeah.
Can the very technology that promises to save money actually be affordable enough to put in place to begin with?
Exactly. That's the puzzle. And the sources, they really lay out both sides. They show how AI can be a tool to cut costs, but also flag the big hurdles around its own price. So let's start with the first bit. Where are we seeing AI actually make a financial difference? Reducing costs, maybe helping capture revenue better?
Well, one way to think about it is AI as a kind of ally in what the sources call cost center optimization. Basically finding smarter, more efficient ways to run things within a hospital or clinic, reducing waste. And they point to some specific areas. A really big one is revenue cycle optimization.
Okay, revenue cycle optimization sounds a bit corporate. What does that actually mean for a clinic or hospital?
Right, fair point. Think of it as, everything related to getting paid for the care provided. From the moment a patient schedules an appointment, through coding the treatment, sending the bill, handling insurance claims, collecting the payment, it's that whole financial flow. And the huge headache in that cycle is claim denials, insurers rejecting claims. Often, it's because of simple mistakes, a wrong code for a procedure, missing patient info, little errors, but they happen all the time. And then staff have to spend ages tracking down the problem, fixing it, resubmitting the claim. That costs time, delays payments, it's inefficient. So this is where AI steps in. The sources talk about AI systems that can automatically scrub these claims before they're even sent out. They spot potential errors. Some can even predict if a claim is likely to get denied based on past data.
Okay. So it's like a spell checker for medical bills almost.
Kinda, yeah. A sophisticated one. By catching those errors up front, you get fewer denials, much fewer. Payments come through faster. And there's this one example really striking.
Yeah.
A rural clinic mentioned in the sources. They brought in an AI-powered coding assistance tool. And get this, they cut their claim denial rate by 40%.
Wow, 40%, just from AI helping with coding.
Just from that. For a smaller clinic, recovering that much previously lost revenue, that's a massive boost to their financial stability. Huge. Plus, the sources also mention AI helping spot potentially fraudulent claims, which saves money for insurers and, ultimately the whole system.
Okay, so it's not just trimming expenses, it's actually bringing in money that was slipping through the cracks. Very interesting. What about savings inside the hospital? Operational stuff?
Absolutely. Beyond the billing office, AI shows potential for optimizing lots of internal processes, things that directly reduce operational costs. The sources mention supply chain optimization, for example, using AI to better predict what supplies are needed when, managing inventory more tightly. Less waste, lower storage costs,
Makes sense.
And predictive maintenance for equipment. AI figuring out when an MRI machine or some other critical piece of gear might need service before it breaks down. That avoids costly emergency repairs, avoids canceling patient appointments. Big savings there, potentially.
Right, and keeps things running smoothly.
Exactly. Patient flow optimization, too. Managing appointments better, cutting wait times, making sure patients move efficiently through different departments.
Right.
It all adds up to less wasted time and resources.
Yeah.
And think about resource management more broadly. We saw examples like AI cutting the time pathologists need to generate reports by 40%. That frees up highly skilled people. In radiology, AI improving image quality might mean fewer repeat scans are needed, or maybe even slightly shorter scan times per patient. That lowers the cost per scan.
Okay.
Even things like clinical trials, AI can apparently make finding and recruiting the right patients faster and cheaper. And personalized medicine. That's a big one.
Using things like genetics to tailor treatments.
Right. Pharmacogenomics is the term often used. AI analyzing genetic data to help choose the best drug for that specific patient from the start. The idea is this could reduce hospitalizations, avoid trying treatments that won't work or might cause bad side effects, lowering overall healthcare costs in the long run. Even just AI predicting how long a patient is likely to need a hospital bed that helps manage bed availability better saves money.
That's quite a list. It really paints a picture of potential long-term ROI, making processes much more efficient. But okay, let's pivot back to that elephant in the room we mentioned earlier.
The upfront cost.
Exactly. Buying the tech, installing it, integrating it, training people, keeping it running, especially thinking about India, such a diverse system. You've got big modern hospitals, sure, but also countless smaller clinics, rural providers. How do the sources say we tackle that initial financial barrier?
Yeah, and this is really the core challenge that the sources keep hammering home for India. For AI to have a real impact nationwide, the solutions have to be cost-effective. They have to be genuinely accessible to hospitals and clinics of all sizes, not just the big players in major cities.
So what are the strategies then? How do you bridge that gap, make it affordable?
Well, fundamentally, the argument is it needs to start right at the design stage. It's about consciously creating cost-effective solutions. Thinking beyond just the clever algorithm, considering the total cost, how easy it is to implement in, say, a district hospital setting with maybe limited IT support. And technology itself can help lower the barrier. Using open source AI platforms and tools comes up a lot.
Right, avoiding expensive licenses.
Exactly. It dramatically cuts down development and deployment costs compared to proprietary black box systems. It also encourages more local innovation, tailoring solutions to specific Indian needs. Leveraging cloud computing is another big one. Using cloud platforms means hospitals might not need to buy and maintain as much expensive server hardware themselves. It offers scalability pay for what you use.
But that needs good internet, right? Which isn't everywhere yet.
That's the crucial caveat, yes. Connectivity is still a major infrastructure challenge in many parts of India, especially rural areas. So cloud isn't a magic bullet on its own, but is part of the picture where feasible.
Okay, so open source, cloud. What about the actual rollout? How do you introduce this stuff without breaking the bank?
A phased approach. This comes up again and again in the sources. It's strongly recommended. Meaning, instead of trying a massive big bang implementation, putting a complex AI system everywhere all at once, which is incredibly expensive and disruptive, you start smaller. Pilot projects. Maybe in one department first. Or focusing on a use case that offers clear, quick wins, but isn't overly complex to implement. Like that AI claim scrubbing tool we talked about. Start in the billing department, prove it works, then think about expanding. Or an AI assistant for one specific type of radiology scan.
So kind of dip your toe in the water, show it works, build some momentum before going all in.
Precisely. You demonstrate the value in a real-world setting. You learn lessons, you refine the system, you build confidence among the doctors, the nurses, the administrators who need to trust and use it. And, crucially for the cost issue, it breaks down that big upfront investment into smaller, more manageable steps. That's much less daunting, particularly for smaller hospitals or clinics with tight budgets. The focus, as the sources really stress, needs to be on practical applications that solve real, pressing problems within the Indian healthcare system first. Address the major pain points, show a clear benefit, and the cost justification becomes much easier.
That makes a lot of sense logistically and financially. Were there any other, maybe more creative financial models mentioned beyond just making the tech cheaper or phasing it in?
Yes, actually. One idea that stood out was exploring outcomes-based pricing models.
Outcomes-based. What does that mean?
It means, especially for AI tools directly involved in patient care, like diagnostics or treatment recommendations, the cost isn't just a flat fee for the software. Instead, the vendor's payment, or part of it, is tied to the actual results achieved.
So, like, the company selling the AI only gets fully paid if patients using its recommendations actually get better faster or have fewer complications or something like that.
Exactly that kind of thing. It aligns the incentives beautifully, doesn't it?
Yeah.
The AI vendor is now directly motivated to make sure their tool really works well in practice, integrates smoothly, and genuinely helps improve patient care because their revenue depends on those positive outcomes.
Yeah, it shifts the risk a bit.
It does. It reduces the risk for the hospital or clinic investing in the tech. They're paying for demonstrated value, not just for code. And if it leads to better outcomes, that often means lower downstream costs, fewer readmissions, shorter stays. It builds trust. Of course, the sources also mention the more standard approach of seeking funding government grants, private investment, philanthropic support, especially important for getting initial pilot projects off the ground or deploying AI in underserved communities. And one last cluster of factors influencing cost effectiveness, things like integration. How well does the new AI tool talk to the hospital's existing systems? If it requires ripping everything out, that's a huge hidden cost.
Or compatibility.
Data quality is another big one. AI is only as good as the data it's trained on and uses. If the hospital's data is messy or inconsistent, the AI won't work well, and the investment is basically wasted.
Garbage in, garbage out.
Pretty much. And finally, user adoption. You can have the best AI tool in the world, but if the doctors and nurses don't understand it, don't trust it, or find it hard to use, it just won't deliver its potential value. So training and usability are key parts of the total cost and ROI picture. These aren't just side issues. They're central to making it work financially.
Okay, so putting it all together, it seems like this cost challenge for AI in Indian healthcare isn't simple. It's got multiple layers. There's the price tag of the tech itself, yes. But just as important is designing it to be affordable, using smart strategies like open source and cloud where possible, and then implementing it cleverly, starting small, proving the value, plus exploring new ways to pay for it, like tying cost to actual results. And finally, making sure it fits in, uses good data, and people actually use it. The sources seem to offer a really practical path forward.
I think that's a great summary. It's not just about creating powerful AI. It's about creating powerful AI that is truly affordable, truly accessible, and demonstrably adds value within the specific context, the specific realities of healthcare in India. Because ultimately, only when you achieve that accessibility and affordability can the transformative potential of this technology really benefit everyone, improve health outcomes across the board.
A really crucial point. This whole conversation highlights that it's as much about smart economics, practical implementation, and understanding human factors as it is about the underlying technology itself. Thanks so much for walking us through that.
My pleasure. It's definitely a complex area, but one with immense importance, so thinking through these layers is critical.
Agreed. And thank you all for joining us on this deep dive. It leaves us with a thought, doesn't it? Considering all these strategies, phased rollouts, open source, the outcomes-based pricing idea, how might these approaches actually start to reshape the whole business of healthcare delivery, not just tech adoption, especially in places like India? What specific AI applications, maybe focusing on preventative care or managing chronic diseases that affect so many, could be the first ones to really scale up affordably using these methods, reaching millions who could benefit most? Something to think about. We'll see you next time.